While most pest animals in Australia and New Zealand are non-native species, not all are introduced. Many Australian animals have been released in New Zealand, which now recognises the brushtail possum as a serious pest. A study was conducted by Dave Ramsey in a patch of native forest near Manawatu in New Zealand from 1997 until 2001. The site encompassed an area of around 14 hectares and contained a population of around 100 possums. Ramsey investigated two contraception methods, tubal ligation and gonadectomies, and the effect they had on the behaviour of brushtail possums. He extended his research further by conducting an experiment which focused on the difference in seasonal breeding ranges as well as the transmission of the Leptospira balcanica disease both before and after the fertility control treatments. Leptospira balcanica is a commonly occurring pathogen in possums, and it is mainly spread through social or sexual interactions. Trapping was conducted 3 times per year for 4 consecutive nights in January, June and September. All captured possums were administered with an ear tag for identification purposes. 2 alternative methods of fertility control were artificially imposed on individual possums. The first method was the surgical ligation of female oviducts that would potentially not interfere with the hormonal regulation of fertility. The second method was to surgically remove the gonads in both male and female possums, which would block the endocrine control of reproduction. In another experiment to investigate the transmission of the Leptospira balcanica disease, Ramsey tested at bi-monthly intervals from January 2000 until August 2001. Each captured possum had 5 ml of blood drawn from a tail vein, and the presence of L. balcanica was determined through a serological microagglutination test. If no reaction occurred, then the result was negative. Between January and September 2000, 26 possums were randomly selected to receive gonadectomies, and another 33 sexually intact possums served as controls. This was to test the seroconversion of possums to the Leptospira balcanica disease. Ramsey tested the effect of sterility treatment by using the subset of possums that had both pre- and post-treatment seasonal breeding range estimates in consecutive years. Calculations indicated that males which were treated with gonadectomies had a significant reduction in both their 95% and 70% isopleth ranges in the year following their treatment application. This compares with the sample of sexually intact males, whose range size did not significantly change in the following year when no treatment was applied. Female possums, which were overreactomized, had a significant reduction in their 95% isopleth range, but not in their 70% isopleth range size in the year following their sterility treatment application. The experiment involving the disease transmission of L. balcanica discovered that of the gonadectomized possums, 3 had developed antigens to combat this disease at the conclusion of the study. However, 10 control possums had also seroconverted over the same period. The estimated force of infection in gonadectomized possums was reduced by 88% in males and by 63% in females, compared with the intact control possums. Results suggest that fertility control, either by immunocontraception or the disruption of the endocrine control of reproduction, are unlikely to have an impact on the social organisation and behaviour of brushtail possums. By disrupting the endocrine control of reproduction, the transmission rate of directly transmitted pathogens may be reduced.